Coronavirus disease is caused by the severe acute respiratory syndrome coronavirus 2, which some people refer to as COVID-19. Hello, Jaira Abanid is my name.
I'm Charlen Paragoso.
And I'm Angel Fatima Montenegro.
We are in the 10th grade from section Paraguay.
In this video, we'll go over a few ways or tips to prevent COVID-19 transmissions.
Because of global spread of coronavirus, many people will now need to take specific action steps to help reduce its transmission.
These are proactive precautionary measures designed to keep us all safe in all situations. There are 12 precautions to take to avoid COVID-19 transmission. Tip number 1. Wash your hands frequently. Hand washing is one of the most effective ways to keep bacterial and viral illnesses at bay. One of the most important ways to help prevent the spread of coronavirus is to wash your hands frequently. People's hands pick up germs and dirt as they touch objects and other people throughout the day. Individuals can then spread these contaminants to others or infect themselves by touching their faces. Many people, however, do not wash their hands thoroughly or for long enough to remove germs. The Department of Health, or DOH, recommends to wash your hands for at least 20 seconds. In the absence of a timer, they recommend singing Happy Birthday twice while washing your hands. People should wash their hands for at least 20 seconds with plenty of soap and water, especially after utilizing public transportation, being present in a public place, and when coughing and sneezing. While washing with soap and water is the most effective method of removing bacteria and viruses from the skin, these two items are not always readily available. If soap and water are not available, an alcohol-based hand sanitizer containing at least 60% alcohol is an acceptable substitute. Washing hands with soap or hand sanitizer helps kill any viruses on the hands that people may have come into contact with. It is important to note that hand sanitizers do not kill all types of microbes and do not remove visible dirt, grease, or chemicals from the skin.
Tip number 2. Cough and sneeze into the elbow. Sneezing is your body's way of getting rid of foreign substances in your nose. Sometimes all it takes is a shake of pepper or a speck of dust to start a sneeze. Coughing or sneezing can cause droplets to fly several feet. They can also linger in the air or on surfaces long enough to spread the infection to another person. However, you only have seconds to react when you feel a sneeze coming on. The COVID-19 pandemic has demonstrated how easily a virus can spread from one person to the next. Covering your mouth when you cough or sneeze is one way to help slow virus transmission. When not wearing a mask, the DOH recommends using a tissue to cover the mouth and nose when coughing or sneezing and using the inside of the elbow if no tissue is available. It is recommended that you wash your hands after coughing or sneezing. Coughing or sneezing into your elbow is preferable to covering your mouth with your hands because you are less likely to touch that area and spread germs to others.
Tip number 3. Dispose of used tissues immediately. When you're done sneezing with tissues, throw them in the trash, preferably in a container with a garbage bag. This bag should be placed in another bag, securely tied and stored separately from other waste. The waste disposal bag should be kept in your home for at least 72 hours before being disposed of in your regular external household waste bin. Please then wash your hands.
Tip number 4. Avoid crowds and public gatherings. As mentioned previously, avoid contact with others. This includes avoiding crowds and public gatherings. Large gatherings bring together a large number of people from various households in a private or public setting. Large gatherings are frequently planned events with a large number of guests. While small gatherings are informal and may take place with family and friends with whom you regularly socialize, often at someone's home, they usually do not entail long-distance travel. But whatever type of gathering it is, we must carefully consider the level of risk we are taking by attending such gatherings. Being in crowded places such as restaurants, bars, fitness centers, or movie theaters puts you at greater risk for COVID-19. So it is far better to stay at home or indoors.
Tip number 5. Avoid touching your face. People should avoid using their hands to touch their eyes, nose, and mouth, especially if they are unwashed. They can help to limit the spread of germs and reduce the chances of them becoming ill. Throughout the day, the hands come into contact with a variety of surfaces and may pick up viruses as a result. If a person then touches their face, viruses can enter the body through the eyes, nose, or mouth.
Tip number 6. Avoid contact with others. People should avoid close contact with others, especially those who are elderly, ill, or shown symptoms of the virus. Stay at least 1 meter away from anyone who is coughing or sneezing according to the Department of Health. This is because when a person coughs or sneezes, small droplets of virus leave their mouth and nose. Other people can breathe in these droplets, catching any virus that may be present. If a person lives in a community where the coronavirus is present, the relevant government will most likely provide additional guidance on how to implement social distance. This could include staying at home or working from home, avoiding contact with anyone who is not a member of the family, prohibiting large crowds from congregating, discontinuing non-essential services such as bars and restaurants. This is especially important for people who are at a higher risk of becoming seriously ill as a result of COVID-19, such as the elderly and people who have the following underlying health conditions: cardiovascular problems, respiratory problems, and diabetes. More vulnerable people may need to take extra precautions such as staying at home and isolating themselves.
Tip number 7. Clean all shared surfaces frequently. Keeping all surfaces clean is the most effective method of prevention in the home. All surfaces that people touch regularly, such as light switches, door handles, and countertops, should be cleaned. They can do so with water and a household detergent. A person may wish to use a detergent followed by a disinfectant on visibly dirty surfaces.
Tip number 8. Avoid all non-essential travel. Stay at home except to get groceries, medication, or other necessities to help slow the spread of COVID-19. Avoid going on outings that you don't have to go on. If you must travel during the COVID-19 pandemic, keep your distance from other people. Cover your face with a cloth or wear face mask. And wash your hands frequently with soap and water for at least 20 seconds or use hand sanitizer.
Tip number 9. Call ahead before going to a clinic or hospital. In an area where there is a COVID-19 outbreak, anyone with a fever, cough, or difficulty breathing should seek medical attention. When you call ahead before visiting a healthcare facility, you can lower the risk of the virus spreading to others. They might, for example, have the person use a special entrance at the hospital to keep them away from vulnerable patients.
Tip number 10. Isolate yourself if sick or at risk of complications. If a person has mild COVID-19 symptoms, they can isolate themselves by staying at home and avoiding social contact. It is best to stay inside and rest if a person is unsure whether they have COVID-19, a common cold, or something else.
Tip number 11. Work from home if possible. Staying at home is the safest thing you can do for yourself. Telecommuting is a critical step in reducing the impact of the pandemic. For those who have never worked remotely before, it is an adjustment that can be stressful. It is critical to plan and communicate. But if you can't work from home, know what the risk is in your workplace. Wear a mask and make sure that those around you also wear a mask. Strengthen social distance at work if possible.
Tip number 12. Wear a mask if you are sick, have COVID-19, or are caring for someone with it. Face masks have become necessary tools for preventing COVID-19 infection in yourself and others. The Department of Health advises people to cover their faces in public places, especially since studies have shown that people infected with the coronavirus may be asymptomatic or presymptomatic. Face masks are meant to act as a barrier between your airway and the rest of the world. By wearing a mask that covers your mouth and nose, you reduce risk of serving as a source of disease transmission by trapping your droplets in the mask, as well as the risk of becoming ill from coronavirus-infected droplets by blocking access to your airways.
People can help protect themselves and others by taking steps to prevent the spread of coronavirus. Hand washing and social distancing are two simple steps that can help reduce the impact of the coronavirus. If someone has COVID-19 symptoms, they should stay at home and wear a face mask around others. They should seek medical help as soon as possible if they have severe symptoms or at a higher risk of COVID-19 complications. It's also crucial to stay informed about the recommendations and cancellations made by their local government. We must all know and accept that staying safe will necessitate our participation.